Hi, my name is Beth Griffin Russell. I'm the owner of Studio Sapan and co-founder of Thai Herbal Topicals. I'm going to try to make a really brief video about 3 oils that I have available because I just made a 20-minute video where I go into detail about all of them, and I just wanted to do something really fast. So I have 3 oils that are based in the principles of Thai traditional medicine. The formulas have not been modified by me. They are made by the Thai traditional herbalist, but I helped to commission and kind of provide the guidelines for formulating them based on my understanding of Chinese herbal medicine and my clinical experience with them. So they also smell really nice, which is it's a different scent profile than a lot of the Chinese herbal topicals. So first one is activating oil. This one actually it's quite green. It's over 50% herbal extract. It is activating, so it's aiming for blood circulation as well as reducing inflammation. I would say none of these oils necessarily go to the blood level. This would be the closest getting there. I would use a liniment for that. So these can be layered with a liniment, then use the oil, which does have some alcohol in it, and then balm on top. So this is meant to treat aches, arthritis, and anything that is an old injury, blood stasis, blood deficiency, and then also like acute pain that doesn't necessarily have a ton of hot swelling. So the ingredients primarily, the 5 main herbal infusion ingredients are Thai ginger, which is called plai in Thai, and that is just it's a variety of ginger that is used in Thailand, that's native to Thailand, which has multitude of healing properties, but it's not as spicy and warming as the ginger that's used in Chinese herbal medicine. The second ingredient is shirchangpu, Acorus calamus, or sweet flag. So again, another beautiful rhizome that's native to Thailand. Third one is galangal, one of the more blood-moving herbs in the formula. Asian spider flower and Cassia siamia. These are all wound healing, anti-inflammatory. Some are a little bit more stimulating, like the plai and galangal, and they're transforming damp to some degree. The other ingredients in the oil are methyl salicylate, boreal camphor, menthol, and a little bit of eucalyptus oil. So it does have a green herbal scent with a little bit of that on top, and it's not a high percentage of those aromatics that have been used to help extract the herbs. The goal is to get it just enough for the transdermal effect and for increasing the analgesic effect, but not to overpower somebody with menthol. So that makes it easy to use in clinic. The second one is balancing oil. It's bright yellow. It's gonna stain stuff yellow, so be careful with it. But it's also one that I use on the most wide variety of people in clinic, as the name would imply, balancing. So there's no menthol, camphor, boreal, methyl salicylate, or eucalyptus in this one. It's just a clove oil and coconut oil as a base, with the herbal infusion, again, over 50% of the liquid in it. And it's just this amazing yellow color. You would imagine it would be a spleen oil, and it certainly is. So lemongrass, kaffir lime, again, plai, Thai ginger, white turmeric, and spider lily. These are all wound healing. And then also will help with digestion and kind of are antispasmodic. So it's really wonderful for cramps, bruises, any kind of digestive complaints. It's super grounding, and it's just wonderful for stress that causes muscle tension and digestive problems. It's also really safe for kids 3 years old and up, and I love using it on children for their growing pains, for their aches and pains from trampolines and bike riding and all that stuff. So I would always keep it in clinic as a kind of like a hidden remedy to pull out for your peds patients. And it's also, the smell is quite soothing and mild. So it's really nice for that. Cold is the last one. I've had reports of people using this one for helping to stop an asthma attack, and it's exceptionally good for treating the skin swelling and inflammation from insect bites, from psoriasis, from like even red skin syndrome kind of stuff. I'd use it sparingly, just a tiny bit, goes a really long way, and it does make you feel really cold. So it's quite amazing for both swelling and inflammation. This one has boreal, camphor, menthol, and eucalyptus in it as well. The scent is a little bit similar to the activating oil, but it has this interesting little medicinal note on top of it that's from the herbal extract. There is actually pandan leaf in it, which you think of as maybe like a sweet herb. And that's part of one of the ways that it's actually treating dampness. There's hop-headed barleria, there's snake grass, there's betel leaf, and there's also Guinura pseudochina. So there have been studies for using a lot of these for actually treating cancer and melanomas, as well as treating like boils and fungal infections and bacterial infections. So this one goes in my emergency kit for sure. So if I were walking through the jungle and needed to make sure that I could relieve wasp or, wasp stings or fungal infections, I would use this one. So in the Pacific Northwest, I don't use it as often, but it's a really nice one to have around. And again, you can layer it, and a little bit goes a really long way. Just use a few drops, and people can really experience a lot of relief very quickly. So anyway, I've tried to make this shorter, and it's still 8 minutes long. So sorry about that, but I hope you check it out. My website is thtpdx.com or studiosapan.com. And I look forward to supporting you as a healer in your clinic or as a patient with your family. Take care.